The spike protein of SARS-CoV-2 contains a receptor binding domain that binds to the ACE2 receptor on host cells to facilitate viral entry. Monoclonal antibodies that bind to the receptor binding domain prevent viral attachment, thereby neutralizing the virus. Studies of the SARS-CoV-2 genomic sequences indicate that regions encoding the receptor binding domain of the spike protein are highly conserved, providing a stable target for monoclonal antibodies. However, rare and substantial mutations in the spike protein close to the receptor binding domain have been observed. These mutations could potentially alter the structure of the spike protein, affecting binding of monoclonal antibodies or altering the pathogenicity of the virus. Mutations arise intrinsically as copying errors during viral replication. SARS-CoV-2 appears to mutate more slowly than other RNA viruses, including influenza and HIV, due to the fact that coronavirus polymerases have a proofreading mechanism. It is estimated that a typical SARS-CoV-2 virus accumulates 2 mutations per month in its genome, a rate of change about half that of influenza and 1/4 that of HIV. Although most mutations are silent or harmful for the virus, occasionally a single mutation may arise that alters the virus's pathogenicity or allows the virus to resist available treatments. Such resistance is more likely when selective pressure is applied by a therapeutic. Single antibody treatments may exert selective pressure on the virus, encouraging the spread of mutants that do not bind to the therapy. Dual neutralizing monoclonal antibody cocktails use pairs of highly potent individual antibodies that simultaneously target the receptor binding domain of the spike protein. However, these pairs do not compete for binding to the receptor binding domain. The use of dual neutralizing antibodies prevents viral resistance by requiring the unlikely occurrence of simultaneous mutations at 2 distinct genetic sites for viral escape.